Today we're going to demonstrate finding centric relation on a patient. As you know, centric relation is the most anterior superior position of the condyle in the articular fossa with the disc interposed. It is somewhat difficult to find in some people, and it is important for us to find because most people, 90% of people, do not close MIP in centric relation. But what we need to do is we need to determine where centric relation is so that we can find any prematurities or any interferences from normal occlusal form in case there is any pathology. So today I'll demonstrate how to do that. So first we want to check to make sure that there's no obvious abnormalities. Muscles are tender, no soreness, no splinting. Check to see that that there's no pain or anything in the joint. Check to see if there's any displacement of the disc, any clicking, noises, everything is fine, no pain. Good. Okay. So what we do is we want to make sure we manipulate. There are two ways, more than one, but there's basically two ways to do this. One is the bimanual manipulation, which is what we're going to be doing here. I find this to be most reliable and a little bit easier, more diagnostic when we're talking about if there's any temporomandibular disorders or there are some pathology happening. This is the best way to overcome that and find the centric relation position. It is also one that we can actually verify the position, and it's also one that we can actually train the patient so the patient knows and understands what we're looking for. After this, we'll show using one-handed manipulation, which gives us the freedom to have a hand to do some work, and we can have a little bit better view of what's going on in the mouth. It's a little hard to see that here. So we're going to now find the place Stephanie's into centric relation, and then we're going to find which tooth is, what are the teeth that are interfering. So we start off by just having open and close slowly, but don't touch your teeth together. Right, now just stick your jaw forward, clunk it back, forward, drop it back, back. So when it comes down, that's where I want you to be, okay? I'm just going to put my fingers on your jaw, open and close slowly, but don't touch. Keep your jaw way back. Let it fall down. Okay, I'm going to add a little tension here, a little pressure. Any tension or tenderness by your ears? Okay. And when I say, please close your teeth together lightly, feather light, and tell me which side the first tooth touches at. And then once you find it, just open. Okay, go ahead. Feather light, feather light, feather light. Okay, open. Again, relax, keep your jaw down, open and close slowly. Again, little pressure. Any tension or tenderness by your ears? Okay. Again, now this time, when I say feather light, close and point to the tooth if you can. Okay, feather light, point to the tooth. Okay, open. Excellent. Okay, so we have found the premature tooth. It's here. Now I know last time we found it over here, and when you close from that position, you find there's almost no slide. So it's very, very close. Her centric relation position is very, very close to her maximum decuspation position. And the difference from one side to the other for a different tooth is quite random, depending on how much pressure or how much whatever. It's that close that it's really, you can't really tell which one is which. Okay?